I want to share some common reasons why IVs are missed and give you some tips and tricks to help navigate and combat these difficult IV sticks. Number one, your vein is rolling. I don't really have big juicy veins, I'm sorry, but what I like to do to help combat this is actually kind of tether the vein down. So you can see my vein right here. When I'm going to stick it, I'm actually going to kind of slightly gently press and pull down to make sure the skin is nice and taut. That way when you poke your needle in, your vein isn't kind of just doing one of these. Also, the quicker you kind of jab your needle in, the less likely you're just going to be kind of pushing that vein with your needle. Two, your vein is blowing. This can be for a lot of reasons. One, maybe your tourniquet's too tight, and so you need to either loosen your tourniquet, do no tourniquet, use a blood pressure cuff, or some less tourniquety type of thing. You could also be pushing your needle through the vein, so it's important that right when you get blood return, you kind of lower the angle of your needle and advance the catheter. Don't keep pushing that needle through because it could be just going right through the vein, and then when you flush it, you're like, oh, it's blown. You also could be pushing your flush too fast, so gently flush your IV fluids. Make sure you release that tourniquet first before you flush your IV as well. Number three, you may be using the wrong size IV gauge. In patients with smaller, more fragile vessels, you may need to use a smaller gauge needle. Number four is you might be hitting a valve. If you've ever actually gotten good blood return and you start advancing your catheter and then it's really difficult to push that catheter in all the way, you might be hitting a valve or your vein could be bifurcating. What I like to do for this is I'll actually have my flush hooked up and I will gently flush, very, very gently, as I'm trying to advance the catheter. So when you're flushing, hopefully that valve opens up with that fluid and you can advance the catheter in past the valve. Number five, you just need some more confidence. I'm telling you right now, if you tell yourself, I'm gonna go in, I'm gonna get this IV, it helps you have the confidence and not be as nervous to do that IV stick. And most of our patients don't have nice, juicy, obvious veins like this in the hospital. We take care of a lot of elderly patients that have multiple comorbidities. Their veins are more fragile and less healthy, so it just makes it more difficult. Ask your patient, where have you had IVs started before? What tricks or tips have other nurses told you that have worked to help you get those IVs placed so we don't have to stick you as many times? Most patients will be able to tell you, oh, they always get this vein here, this arm never works, they have to use heat, they have to use an ultrasound, I have to pump my fist multiple times. So ask your patients where they've had IV sticks done before and where they've been successful. I hope that helps. Let me know if you have any more questions.